So welcome. In today's session, we are going to look at cartilage. Okay, a minute. And by the end of this session, you should know the types of cartilage. You should know the histology of each and every type and the location. So, welcome all. My name is Waris Munyeri, and I'm the Yule Daktari. Cartilage. Cartilage is a specialized connective tissue, and it consists of two basic components, the cells and the extracellular matrix. The cells are known as the chondrocytes. The extracellular matrix is composed of the ground substance and fibers or fibrils. Now, cartilage is an avascular tissue that will receive nutrition by diffusion from adjacent tissues, okay? Now, based on the composition and the mechanical properties of the matrix, cartilage can be classified into three broad categories. Namely, let me take my, I don't know why, sorry for that. Okay, why are you running away? Okay, let me take, I wanted to take a pointer. I don't know why there. Okay, we have three types: hyaline cartilage, elastic cartilage, and fibrocartilage. Now, cartilages externally are supported by a fibrocellular covering known as the perichondrium, except fibrocartilage. So hyaline cartilage and elastic cartilage will have a perichondrium. So if you are given a histological slide and you see perichondrium, rule out fibrocartilage. Fibrocartilage can't be one of your guesses, even if you are guessing. So let's first look at the general features of cartilage. Now, cartilage is derived from mesenchyme or mesoderm. Now, the mesenchymal cells usually differentiate into the chondroblast, the cartilage-forming cells. Now, the chondroblast usually produce the intercellular matrix or the extracellular matrix, as well as the collagen fibers that usually form the extracellular matrix or the intercellular substance of cartilage. Now, then the chondroblast that become imprisoned within the matrix, they form the chondrocytes. Okay. 2, cartilage has limited ability for regeneration. It is a poor regenerative tissue. Why? Remember, it is avascular. So the cells cannot move to the site of injury for repair, for regeneration. So it has poor regeneration. So 3, cartilage is defined as avascular. However, there is presence of cartilage canals through which blood vessels may enter the cartilage. Okay. Also, remember I said the cartilage cells usually receive nutrition by diffusion, especially from the vessels in the cartilage canals or from the vessels in the perichondrium. Okay. Then growth of cartilage. We have two types of growth. We have interstitial growth and appositional growth. Now, newly formed cartilage grows by multiplication of the cells throughout its substance. This kind of growth is known as the interstitial growth, and it is only possible as long as the matrix is sufficiently pliable to allow movement of the cells through it. Now, once the matrix hardens during maturity, that is, the cells can no longer move. So interstitial growth becomes impossible. Now, at this stage, when a cartilage cells divides, the daughter cells usually remain close together, okay? They will form the isogenous groups, okay? Now, further growth of cartilage now takes place by addition of new cartilage over the surface of the existing cartilage, okay? The appositional growth. And this appositional growth is possible due to presence of the chondroblasts on the inner cellular layer of perichondrium. Okay. Now, let's look at hyaline cartilage. Now, histologically, Hyaline cartilage is glass-like, has a glass-like matrix. Hence the name hyaline from the word hyalos, which means glass in Greek. It is clear, it looks like a glass-like matrix. Where is it located? It is the most abundant cartilage in the human body. It is present in the following location: the fetal skeleton, the articular cartilage, the nose cartilage, that is the septal cartilage. You have the costal cartilages. We have the laryngeal cartilages, the thyroid, cricoid, and the base of the arytenoid cartilage. But the tips of arytenoid cartilage are not hyaline cartilage. They are elastic cartilage. We also have the trachea, the bronchi. Those remember the horseshoe-shaped cartilage rings, the cartilage in the trachea. Those are hyaline. We also have the epiphysis. Okay. Now, histology of hyaline. It consists of cells and the extracellular matrix, that is the ground substance. Now, the cells, the chondrocytes. The chondrocytes divide and deposit matrix around them. Now, these chondrocytes usually occupy lacuna in matrix. Now, lacuna are the spaces. Now, lacuna are an artifact. They usually, during preparation, the chondrocytes usually shrink and they leave a space, the lacuna. But in real life, the chondrocytes usually occupy that space. But during preparation, it will shrink and leave out a space. Now, we also have what are known as the cell nets or isogenous groups. Now, in developing cartilage, chondrocytes divide to form daughter cells. Now, these newly formed daughter cells lie in a group surrounded by the territorial matrix. Remember, once the matrix hardens, the daughter cells remain close together. Now, such a group of daughter cells or the chondrocytes raised by a single mother chondrocyte is known as an isogenous groups. These isogenous groups form the cell nests. Okay, now let's have a look. First, you can see the perichondrium here. Now the perichondrium, now here is the perichondrium. From here up to there, it has an outer fibrous layer and an inner cellular. That is why it is a fibrocellular covering. Okay, then you can see on the inner cellular layer, here you can see the chondroblast. Okay, then I want you to look at this matrix. You can see it looks like glass, clear, hyalos. So this is hyaline cartilage. You can see grassy appearance. Then you can see the chondrocytes in lacuna. You can see them. So if you are ever given a histological slides and you see cells in lacuna, if you are not thinking about cartilage, think about bone. Okay. So then here you can see this, like this, you have the chondrocytes here in groups. So these are the isogenous groups. You can see them, the isogenous groups. And these isogenous groups are mainly groups of 2, 4, rarely 8. You can see here 2, 4. Okay, 2. I don't know. You cannot see it. 3. No. Then, okay. Now the extracellular matrix. We have talked about the cells. Now, what about the extracellular matrix? Now, the matrix of hyaline cartilage has a grassy appearance. Now, the matrix shows spaces that called lacuna with and the chondrocytes reside within the lacuna. Now, composition of the, remember, when discussing the extracellular matrix, you talk about the ground substance and you also discuss about the fibers. Now, the extracellular matrix consists of 80% water, up to 80% water, 15% collagen fibers, and approximately 15% proteoglycans and glycoproteins, up to 5% the chondrocytes. Now, hyaline cartilage consists of mainly type 2 collagen fibers. Note that. Type 2 collagen fibers that usually form a meshwork in the ground substance. Now, the collagen fibers will provide strength and stability to cartilage. Now, collagen fibers cannot be seen in a histological section due to the refractive indices, due to the difference in the refractive indices of collagen fibers and ground substance. Okay. Sorry. Collagen fibers cannot be seen in a histological section because the refractive indices of collagen fiber and the ground substance are the same. Now this will give the homogeneous grassy appearance. Okay. Now, ground substance has 3 types of glycosaminoglycans. Okay. The other name of glycosaminoglycans are acid mucopolysaccharides. Hyaluron, chondroitin sulfate, and keratan sulfate are the main glycosaminoglycans. Okay. Now, the aggrecan, please note this. Aggrecan is the proteoglycan. Okay. The aggrecan is a proteoglycan monomer, which consists of a core protein, okay, and the periphery attached to the core protein are the glycosaminoglycans, namely chondroitin and keratan sulfate, okay, and they will form a bottle brush in a bottle brush fashion. I will show you that. Then aggrecan molecule is negatively charged, and remember, the hydrogen in water molecule is also partially positive, so it will attract water. That is why the matrix is hydrated. Why must the matrix be hydrated? For diffusion to occur. Remember, cartilage is avascular, so nutrients must diffuse through the matrix to reach to the chondrocytes, and for diffusion to occur, we need a hydrated matrix. Okay, let me show you how that is formed. Now, this is the proteoglycan monomer, and the proteoglycan in hyaline cartilage is aggrecan, and you can see it consists of a core protein there. Then it is periphery attached to the glycosaminoglycans, chondroitin sulfate and keratan sulfate, usually attached to the core protein periphery. Okay. Then you can see that now these proteoglycan monomers, okay, the aggregans now will attach to hyaluronic acid. Okay. Then you can see how they will attach. Then you can see here collagen fibrils. Okay, the type 2 collagen. Okay, that is how now the matrix is formed. Have the collagen as the fibrils, then the ground substance will have the glycosaminoglycans, the 3 of them, hyaluronic acid, chondroitin sulfate, keratan sulfate. Then keratan sulfate and chondroitin sulfate attached to a core protein to form the proteoglycan aggrecan, and then they link like that. Okay. Then we have zones now. Then now we have the pericellular matrix. Now this is a ring of densely staining matrix that surrounds the chondrocytes. It has high content of the acidic proteoglycans and type 6 collagen fibrils. Now you can see immediately surrounding the chondrocytes, that is the pericellular matrix or the capsular matrix. Okay, then we have territorial matrix, which now will surround the pericellular matrix, contains dense quantity of sulfated proteoglycans or the acidic proteoglycans, and stains less intense. So the capsular matrix is the one which will stain, density staining. Then you can see next to it have the territorial. Then you have interterritorial. Now between the two territories, interterritorial, they have less quantities of sulfated proteoglycans than the territorial matrix. Now it will be the least stained. Okay. Okay, this area you can see between the two territories, two territorial matrices, interterritorial matrix. Okay. You have exogenous groups. Now, perichondrium. Now, the free surface of hyaline cartilage is covered by the irregular fibrocellular layer known as perichondrium, which has 2 outer fibrous, inner cellular. The outer fibrous consist of dense irregular fibrous connective tissue. Inner cellular It has chondroblasts, which give rise to the chondrocytes. Then the outer fibrous has capillaries that provide nutrients to the interior of the cartilage through diffusion. Perichondrium is absent. Although we are saying hyaline cartilage has perichondrium, it is absent in the following hyaline cartilages: articular hyaline cartilage, and also where hyaline cartilage has a direct contact with the bone. So the cartilage which has direct contact with the bone is articular cartilage. That is why it is absent there. Okay, this is the summary: matrix, cells, perichondrium. Okay, matrix, type 2 collagen, proteoglycan. The main proteoglycan is aggrecan. Glycosaminoglycans, we have keratan sulfate, chondroitin sulfate, also hyaluronic acid. The cells in lacuna, they form isogenous groups: perichondrium, outer fibrous, intercellular locations. Then you have the types of matrices: capsular or the pericellular, territorial, interterritorial. You can pause the video and look at that. Now, elastic cartilage. Elastic cartilage gives resilience, pliability, and elasticity to an organ. Now, freshly dissected elastic cartilage is yellowish in color due to high content of elastic fibers. That is why it is also known as the yellow elastic cartilage. Remember, we have a ligament in the body known as the ligamentum flavum, or the yellow ligament. It is yellow in color due to high content of elastic fibers. Now, where is it located? Please, I have not said ligamentum flavum is elastic cartilage, please. That was just by the way. Elastic cartilage is present in the pinna of external ear, the walls of the external acoustic meatus, auditory tube, epiglottis, the tips of arytenoid, corniculate, and cuneiform cartilages of larynx. Now, histology. You must first state the cells and the extracellular matrix, and under the extracellular matrix, you state the ground substance and the fibers. Okay, it is also surrounded by a perichondrium. The perichondrium in hyaline cartilage is the same as that in elastic cartilage. Now, fibers. Elastic cartilage contains a dense meshwork of branching and anastomose in fine elastic fibers, which impact the yellow color. In addition to elastic fibers, it will have few type 2 collagen fibers. Okay, so ground substance, it is similar to hyaline cartilage. Okay, so in fact, to make your work easier, elastic cartilage is just like hyaline cartilage, to which we have added elastic fibers, just like that. So, but remember, elastic fibers, they will have a difference in their refractive index. It is different to that of the ground substance. So the elastic fibers will be clearly visible, unlike in hyaline, where it looked glassy, the matrix was glassy. Here you see the elastic fibers themselves. Now, what is the difference now? How will you differentiate? Since I've said the elastic cartilage is like hyaline cartilage, to which elastic fibers have been added, how will you differentiate elastic and hyaline cartilage? First, you can use the elastic fibers. Another one is that the chondrocytes usually occupy lacuna, but the lacuna, okay, are larger in elastic cartilage than in hyaline. Okay, and the chondrocytes either they lie singly or in isogenous groups of 2. Here we are. You can clearly see here. You can see these elastic fibers. You can see them clearly. Then, can you look at the size of this lacuna? You can see it is larger than the one of hyaline. Here you can see a blood vessel here in the outer fibrous. Now nutrients will diffuse from there inward. Then here you can see an isogenous groups. Okay. Here you can see these are your elastic fibers. Okay. And see the size of these lacunas are very large. Okay. Now, fibrocartilage. Now, Fibrocartilage usually contain bundles of thick collagen fibers that give a white color to cartilage. Hence, it is known as the white fibrocartilage. Now, fibrocartilage is like a combination of dense regular connective tissue and hyaline cartilage. Okay. Where is it located? Intervertebral discs. Okay. Pubis symphysis, articular disc of sternoclavicular and the temporomandibular joints, the knee menisci, the glenoid and the acetabular labrum. We also have the articular disc of wrist joint. Okay. Now, some fibroblasts, you find some fibroblasts within the matrix. Okay. And how will you differentiate the fibroblasts from the chondrocytes? Fibroblasts will have flat and elongated nuclei. Now, chondrocytes are few in number in fibrocartilage, and they lie singly in isogenous groups. Okay. And also fibroblasts are present among the collagen fibers. And here, let's look at these collagen fibers. Which type? Now, fibrocartilage consists of thick collagen fibers, in fact, not fibrils, because they contain type 1 collagen fiber. Type 1 is the main. Type 1 is the main collagen fiber. And collagen fiber type 1 has the ability to polymerize. So, the collagen fibrils usually polymerize to form collagen fibers. Okay. So type 2 is very minimal, but remember, type 1 is the main collagen type in fibrocartilage. And the proteoglycan, unlike in hyaline and the elastic cartilage, which is aggrecan, here it is versican. Okay. Here we are. You can see now this is a fibroblast. You can see it has an elongated flat nuclei. This is a chondrocyte. You can see you can see how the lacuna are very small lacuna. This is an isogenous group. So this, and this. Okay. Okay, then you can see the bundles of collagen fibers, type 1. No perichondrium. No perichondrium. I've put that there intentionally. No perichondrium. Okay. And please don't confuse fibrocartilage and dense regular connective tissue, and also some people confuse it with the smooth muscle. Please, I want you to look at the differences between those three. If I give you a smooth muscle, you will be able to differentiate it from dense regular connective tissue and also from fibrocartilage. Okay. In fibrocartilage, you will see these chondrocytes. Okay. So fibrocartilage here, the fibers, collagen type 1, please remember that. Okay, perichondrium absent. Remember the proteoglycan is versican. Okay. And please note these locations. And these are the differences between the three types. Please note that. Okay. You can see here, like here in the fibers, here you can see in hyaline is type 2, in elastic is elastic fibers and type 2, few type 2. In fibrocartilage is mainly type 1 and very few type 2. Okay. Then perichondrium is absent in fibrocartilage. Okay. Now the ground substance is produced by the chondrocytes in both hyaline and elastic cartilage. That is why it is known as the aggrecan. But in fibrocartilage, because some is produced by fibroblast, that is why it is versican. Okay. So we've come to the end of this session, and I leave you with one quote, that pressure makes diamonds. Think on that. Thank you. And please subscribe for more anatomy and biochemistry content. Thank you.